In this video, I'm going to go over the home health folder for AW Healthcare. Every patient will receive this folder at their start of care visit from the start of care clinician. It will be in their home. You'll see on the front of the folder, the on-call number is available in big numbers. In the Missouri office, it'll be this number. In the Illinois office, it will be the Illinois number. This is also our on-call number, so encourage patients to call this number if they have urgent home health questions on the weekend or after hours. If they press option number 2, the on-call clinician will call them back. Make sure you encourage them, though, to call 911 in the case of a medical emergency, not our on-call number. So we'll open the folder. You'll see on the left side, we have kind of our policy and procedure packet that the start of care clinician will go over with the patient. You will also see the medication list. This will be filled out at start of care as well. It is important, though, that at every visit we ask the patient if there have been any changes to their medications. If there have been, please review the change order video for that process. But this will be in the patient's folder. It's a regulation issue that we have an updated med list in the folder. The start of care admission service agreements in the folder. This will be filled out at start of care as well. If it's flu season, there might be a consent form for a flu shot. If the patient's interested in having us provide them a flu shot in the home, if we have any available. Every folder will have a bright colored sign-in sheet. This one's orange, but it could be blue, pink, yellow, some kind of bright color. It'll be pretty easy to find. This is our sign-in sheet, but also our written plan of care. So every visit, we want to make sure we sign in with their vital signs, our name, what kind of visit it is, obviously the date. But the written plan of care part is also very important. So it is a regulation item that we leave a written plan of care in the patient's home at start of care. So this will include the patient's information, their personal goal, as well as their emergency plan and emergency contact. These should be completed at start of care. If they're not, if you notice a patient does not have this filled out during your visit, please ask the patient those questions and have that filled out. It's also important that we fill in our individual sections for our frequency and what we'll be working on with the patient. There are some insurance companies that we're not going to know the frequency at that first visit if we need to request authorization, or if it's a PDGM patient. If we don't know, write pending in the box. And then if you are a clinician that follows, make sure if that frequency has been decided on that you fill that in. Again, this is part of the written plan of care. It is a regulation item. We need to make sure those things are filled out. And again, if it's not done by the start of care clinician, please fill those in for them. Okay. There's also going to be a calendar in there if the patient wants to use a calendar to track their dates. On the right side of the folder, there's a couple other handouts in there about AW Healthcare and services we provide. But most importantly, you'll see our discharge documentation. Again, these are some regulation items that are very important. So at every discharge visit for every discipline, we'll need to do this discharge instruction form. So there's multiple of these forms in the folder. There should be enough for every discipline. So you'll obviously want to fill it out with your instructions and have yourself and the patient sign it. You'll then scan it in your phone, upload it to the patient's chart under documents, and then you'll leave this paper copy in the folder for the patient. That's every discipline at their discharge visit. The other form is the NOM-NOG. This needs to only be filled out once for every patient episode, but this needs to be done 48 hours at least before they are discharged from services, so before their discharge OASIS. This can be done by any clinician regardless of what discipline is doing the discharge OASIS. So if a PT is doing the discharge OASIS on a Friday, an OT could do it, a CODA, a PTA, a nurse, anyone could do this discharge oasis, or I'm sorry, discharge notice of Medicare non-coverage, the NOMNOC, on Wednesday or before. So this will need to be filled out with the patient's name, their current home health coverage filled out. You can leave the services will end date blank if you're not sure of when the patient's going to be discharged, what the exact date's going to be. But you'll need to have the patient sign it and then leave it in the folder. Whoever does the discharge oasis will then complete that form on the date they're being discharged, scan it into the system, upload it to documents, and leave the paper document in the home. Again, this is a very important regulation item. This is our notice, the Notice of Medicare Non-Coverage, the NOMNOC. It notifies patients that we are discharging them, and they have a right to appeal that decision. If we do not have this form filled out 48 hours in advance and a patient appeals their discharge, they'll almost always win that appeal because we did not give them adequate notice. And then AW doesn't get paid for the entire episode, from my understanding. So make sure that this is done 48 hours in advance. Leave it in the folder. The DCO clinician will then need to scan it and upload it to documents at discharge. The last form I want to go over here, we don't need to use all the time, but it's called the Home Health Change of Care Notice, or the HHCCN. This only needs to be done if something's changing in their frequency or discharge date. So if we're planning to see the patient for 2 more weeks, but we reevaluate and we decide and the patient is agreeable that we're going to discharge them early, we can put that in here for items of services, say occupational therapy, discharge, reason for change, patient request, and patient's met goals. Fill this out and have them sign it. If you don't decide till that day that you're going to discharge early and that's what the patient wants to do, you can fill out that Notice of Medicare Non-Coverage we just talked about that same day. Just make sure we document in the chart that it was a patient request to discharge. But then this will also need to be scanned and uploaded to the chart. That's, again, only if something's changing, only if we're discharging early or if we're changing their frequency of their plan. So that's our AW folder. Take your time to review the folder and get familiar with it, and feel free to ask any questions.